So we have here the pelvis. Remember? Two coxal bones, one sacrum, one coccyx. Let's describe, and we already said that each of the coxal bones consists of three bones that are fused together. Superiorly, the ilium, anteriorly, pubis, posteriorly, the ischium. So let's describe first the ilium. I want you to place it now, your both hands on your hip bones. And the most superior part, that uh, curved part of the bone that you're feeling, is right this. And we call this the iliac crest. So this is the iliac crest. It's just the superior border of the ilium and of the entire coxal bone. Now, I want you to follow. I'm gonna put this. Okay. I want you, let's see in here in the picture, the iliac crest on the articulated pelvis. This in the lateral view, and the iliac crest in the medial view. Now, when we follow, and remember, we know already how to get oriented with this bone, right? Lateral, where you see the acetabulum, the other part is medial. Anterior is the thinner red part of the bone in your image, and the thickest aspect is the compare both, is the ischium. Now, let's follow this iliac crest down here anteriorly. We're going to see that we have these two projections anteriorly and these two projections posteriorly. These are called the iliac spines. Iliac spines. And we have four. There are two that are superior, and there are two that are inferior. There are two that are anterior, and there are two that are posterior. So let's mix and match this. So anteriorly, we have, this is the anterior and inferior iliac spine. You go up, which is in here. Well, no. You go up, and this is the anterior and superior iliac spine. That's actually the piece of bone that usually protrudes and it can be seen through the skin. This is the iliac anteriorly, of course. This is the anterior and superior iliac spine. You follow the iliac crest back and ends in another bump, and that's the posterior and superior iliac spine, and inferior to that, the posterior and inferior iliac spine. In here in your picture, I have them labeled. Here you have anterior and superior iliac spine in the articulated pelvis, and always on the same side of the pubis bone. That's the anterior and superior. And in here, you can see inferior to that, you can see the anterior and inferior. It's a smaller bump. Posteriorly, you can see the posterior and superior iliac spine, and the posterior and inferior iliac spine. This, the posterior and superior iliac spine, so it's something like that. So this is facing up. This part of the bone is actually located right where you can see the two dimples on either side of the vertebral column on your skin. When you touch that, what you're touching is actually this, the posterior and superior iliac spine. And I tell you later the relevance of this concept. Okay, so this is anterior and inferior iliac spine, anterior and superior iliac spine, iliac crest, posterior and superior, posterior and inferior iliac spine. Now, when you are right here in the posterior and inferior iliac spine, you see a notch. Can you see it? This is the greater sciatic notch. Bum, 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 bum. And it's a notch that lets the sciatic nerve pass through. So look at the notch, look at the diameter, of, well, a little bit smaller than that, of the sciatic nerve. Maybe like, let's see. Yeah, like that. So this is the diameter of the beautiful sciatic nerve, the costa sciatica. We'll talk about that later. Now, when you follow the greater sciatic notch, it ends, well, this is already part of the ischium in this spine. Now, look into your image. This is the greater sciatic notch. Remember, the function is just to let, there is a muscle here, pyramidalis, and it covers like a hole, and then it lets the nerve pass through. That's the function of the greater sciatic notch. Now, again, remember, lateral aspect where the acetabulum is. And the medial aspect, the one that is facing inside the pelvis to the pelvic organs, this part of the bone is called the iliac fossa. Again, it's the medial side of the bone. You can see it in there. So it's touching right there your intestines and colon, okay? Posteriorly to the iliac fossa, and you see that this is the iliac fossa, very smooth. In the posterior part, it gets very rough. Can you see? This is called the auricular surface of the ilium. Again, this is the medial view because I cannot see the acetabulum. So this is the smooth iliac fossa, and posterior to that, I can see the auricular surface of the ilium. That's another way to distinguish that this is posterior, maybe easier, right? That this is posterior and the part that is smooth is anterior. So this is the pubis and this is the ischium. What is going on here in the auricular surface? Do you remember that we have also an auricular surface on the sacrum? So both bones, grabbing the other one, both bones articulate the auricular surface of the sacrum, auricular surface of the ilium to form the sacroiliac joint. Sacroiliac joint. Where can you touch your client, your patient, to see if they have a sacroiliitis or an inflammation of this joint? Right here. See? Right here in the posterior and superior iliac spine. Right there in your temples on the either side of the vertebral column. What else? Well, that's the articulation, see? The right and the left, the sacroiliac joint. And the lateral aspect of the bone, all of this surface, is called the gluteal surface. There's a bunch of lines and blah, blah, blah. I'm okay if you just remember that this is the gluteal surface. And it makes sense. The gluteal surface has to face laterally because in here, in the gluteal surface, is where the gluteal muscles coming from your butt insert or attach in this area. Okay? So laterally, gluteal surface, medially, iliac fossa, and behind or posterior the iliac fossa, auricular surface of the ilium. That's it. See you in the next video to finish this bone, the ischium and the pubis.